Okay, today I'm going to go through the inspection and assessment of the abdomen. First, we inspect, auscultate, percuss, then palpate. So I will have my patient laying down. I would have him take his shirt off so I can inspect his skin, his color, his contour, any peristalsis movements, any pulsations, and check the umbilicus. I would inspect it for if I noticed any masses, hernias, or any muscle separations. I would have him can you lift your head up to your chin? That would let me know if there's any muscle separation here, like diastasis recti. He would have his shirt off, like I said, so I could note any scarring, any striae or stretch marks, any tattoos, bruising, things like that I would want to note. All right, since I have inspected, I will go to auscultation. I will want to auscultate vowel sounds in all 4 of the quadrants. All right, so I will auscultate in the right upper quadrant, listening for the tinkering of vowel sounds. And then the left upper quadrant. And the right lower quadrant. And the left lower quadrant. And while we're listening, we want to make sure that we're hearing between 5 and 30 vowel sound kind of tinkerings per minute. While I am listening, I will go ahead and listen to the aorta, renal arteries, iliac arteries, and the femoral arteries. I'll do that now. Go ahead and check for any bruits in these areas. So the aorta is right above the umbilicus here. And I can use the bell. And that breaks down into the iliac arteries on the left and the right. And then down to the renal arteries on the left and the right again. And then down a little bit lower, we have the femoral arteries. Okay, now that I have auscultated for vowel sounds and bruits in the major arteries, I'm going to percuss, checking for tympany and dullness. I'll do percussion in each quadrant here. During percussion, most of the time we're going to hear tympany because we're hearing over the gases in the air spaces unless we are percussing over one of the major organs. So I will go ahead and percuss for the liver border. I will start at the mid-clavicular line and come up, just noting until I hear that dullness. This is on the right side. Okay. On most patients, it'll be between 6 to 12 centimeters. And I can also palpate for the spleen, which would be on the left side. You're going to want to percuss in between the intercostal spaces. All right. After percussion, we will go to light palpation, which is about 1 centimeter. You just use the pads of your fingers. We'll do that in all 4 quadrants. Just making sure I'm asking the patient if there's any pain, tenderness, or if I note any masses, bulges, or any difference in their muscle tone. So I'll go ahead and do that now. Right upper quadrant, and then the left upper quadrant, right lower quadrant, and left lower quadrant. After light palpation, we have deep palpation, which is roughly 5 to 8 centimeters, again in all 4 quadrants, noting pain, tenderness, any masses, bulging, or muscle tone weakness. Starting in the right upper quadrant here, and the left upper quadrant, right lower quadrant, and the left lower quadrant. All right. And when we're doing our deep palpation, we can check our inguinal nodes. We would do that, which these would be kind of right above the iliac crest here. And then we would check our femoral pulses, which is below that pelvic line there. I can check the abdominal aorta for any pulsations here. Again, right above the umbilicus. Good. Not noting any pulsations. I will check the kidneys. Okay. I do not feel his kidneys. He is a full-size man, so I don't feel them. And I could do CVA tenderness. I would probably do that during my lung and thorax assessment, which I did in one of my previous videos. And then during palpation, I will palpate for the liver. In this right upper quadrant here, I'll have the patient take a deep breath in. All right, sometimes that'll help bring the liver down so that I can feel it. And I can use the hooking technique. So you kind of hook underneath that, the rib cage there, and it'll kind of make it feel, so you can feel it a little bit better. And then I can check for the spleen on the left side as well. During deep palpation, and on a normal patient, the spleen should not be palpated. Otherwise, that would indicate that he has an enlarged spleen. All right. Then I would do all my specialized testing, the Murphy sign,